This video, I want to talk about how to get assistance paying for home health care, whether it's for you or for a loved one, and this pertains to Florida. So, I am a Medicaid planning attorney. I'm an elder law attorney. I focus on estate planning and Medicaid planning. Medicaid planning is my specialty. When people hear Medicaid planning, they often think of nursing homes and how it can help pay for nursing home care. And that's absolutely true. It can pay for nursing home care and assisted living facility care. But what a lot of people don't recognize is that it can also be used to pay for home health care. Now, to be clear, this is not a benefit that you get with Medicare. This is a benefit that you get with Medicaid. Most people come to me because they do not qualify for Medicaid because their income's too high or they have too much by way of assets. And that's what I do. People come to me because they have this need and they don't want to spend all their money until they naturally qualify for Medicaid. So we have some great tools and strategies available that can be used to protect what my clients have now. They don't have to wait 5 years. We can do it now. We can get them approved for Medicaid in a relatively short period of time to get assistance paying for that. So that does a few things. Number one, it protects their savings, what they've worked so hard for, so they can use that money to now supplement and pay for things that Medicaid won't pay for that make life worth living and improve the quality of life and things like that. It makes life a little bit nicer. And then it makes it more likely that they'll have something to pass on to their heirs. I should also note that in Florida, Medicaid does not pay for 24/7 home health care. We typically see our clients getting approved for between 15 and 40 hours a week of care. So it's not everything, but it can be a substantial amount. I have one client who got approved for 55 hours, but that's an anomaly. Mostly it's between that 15 and 40 range. So again, getting that extra help and then segregating that person's money so that they can pay for either that extra home care that Medicaid's not paying for, or whatever else that they need or want to make their life a little bit easier, and to also make it less like that family or friends have to chip in for these expenses, can be really, really valuable. Now, a lot of people say, well, by being approved for Medicaid, am I being relegated to the bad home health care agencies? And the answer is no. What you have to remember is Medicaid is not one thing. Medicaid's an umbrella term for multiple programs. And when you get approved for Medicaid, you don't just get that gold card anymore that maybe you are familiar with or maybe you're not. You pick a plan, and they have big name plans like Humana and United and Sunshine Health, all right? And depending on where you live in the state of Florida, there are different plans available to you. And when you pick a plan, you then get a list of home health care agencies, and you'll get a dozen of them or more, and you can interview the ones that they provide, and you'll get, then Medicaid will pay those agencies directly for whatever hours you've gotten approved. Another choice you have is what's referred to as the participant-directed option, where you can say, listen, I don't want to use any of these agencies. I want to pick someone who I know, whether it's a child, whether it's a spouse, and I want to pay them for hours. You have that choice too. Just be aware the pay is horrible. It's between $10 and $11 an hour. It's not something that anyone's really going to be earning a good living on. So, but if you say I have this one person who, as long as they're legally able to work in the United States and they pass a background check, even if they're related to you, they can be paid if you so desire. So Medicaid can be really, really helpful in paying for not only nursing home care and assisted living facility care, but paying for a significant portion of home health care too. If you have any other questions, you'd like to set up a consultation to discuss how we can protect your assets to get these benefits now as opposed to waiting, give us a call today. We serve the entire state of Florida. Take care.